We just saw President Donald Trump arriving at Walter Reed National Military Medical Center. He'll be treated over the coming days for COVID-19. Doctors recommended that he go there so they can observe him. He will be working there as well. Now, on his way, he did tweet for the first time all day an audio recording on how he was feeling.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
I want to bring in now Bloomberg's health reporter, Jordan Fabian. Jordan, did we learn anything from that video?
Not too much. I mean, the president, he feels fine, but we were hearing earlier in the day from sources that, in fact, he's suffering mild symptoms and possibly worse. And, the problem is that the president's physician hasn't really addressed the public to say what exactly the president is experiencing. He's issued 2 brief letters saying that he's suffering mild symptoms, that he's taking an experimental therapy to try to limit those symptoms. But again, we don't know the full extent of how the president is really feeling. I was out there on the South Lawn to see him depart. He walked out under his own power, albeit a little bit slower than usual. But at the same time, we still haven't gotten that full report from the president's medical team.
And Jordan, I think you just hit it right there on the head, right? I mean, this was in the remarks that we just saw. I mean, he spoke clearly. His voice appeared regular. It appeared normal. Now, based upon the reports that we know about the way this virus works, he is in the early days of having contacted the virus. And so as you play this out, are there, based upon the sources that you're talking to, and it's something that I haven't been able to get a clear answer on from the sources I'm talking to, is when might we hear from a different kind of an address, not just a pre-recorded statement tweeted out via social media, but an address to the nation, a campaign-style speech? When is that? Are those remarks going to happen?
The White House hasn't given us a clear indication, Kevin, but I can tell you that I don't think it's going to be anytime soon. The White House said before the president left for Walter Reed that he would be spending at least a few days there, and it would be a little bit odd I think, for the president to address the nation from a hospital to give them reassurance. I would think, the president, but if he wanted to demonstrate that he was recovered, he would do that from the White House. So it's hard to imagine something happening over the weekend here, or if he stays there into Monday. But yeah, there is, I think, clamoring for some, not only just to see if the president's well or not, but some real information about his condition. This is a very serious virus. It's killed over 200,000 people in America. The president's 74 years old. He's in the age group that's vulnerable. He has some comorbidities. So, the public, I think, is eager for some more information.
Jordan, what's he being treated with right now?
So there's this experimental treatment called Regeneron. It's from a company, the company Regeneron, but it's an experimental cocktail of antibodies that is supposed to reduce the symptoms and the amount of time that it takes to recover. I will point out, though, that this is not a drug that's been approved by the FDA. It doesn't even have an emergency use authorization. It's undergoing trials currently. But the company did put out a statement earlier today saying that the White House had requested it under a quote-unquote compassionate use request, and that they granted it. So they gave the White House some of that drug to try. So it seems like just interpreting that, they think the president might have some serious experiencing some serious issues with this virus, and they want to treat it and nip it in the bud.
Jordan, what was the mood like at the White House today?
It's a good question, Kevin. It seemed a little bit sullen. I have to say, I was out there on the South Lawn watching the departure. There were some aides standing back there, some people on the press team. They looked a little bit downtrodden. And some of the sources that we were talking to today did seem just stunned that this happened, that the president has contracted the coronavirus. The president and his team have had a very cavalier attitude about this virus. They don't usually take the precautions that many others take, like wearing masks, practicing social distancing. The president's been going around the country doing these massive rallies, and there seemed to be an air of invincibility around the president and his staff, just thinking that this wouldn't affect them. And now that it has, maybe it's not surprising to the general public, but it does seem to be come to somewhat of a surprise to some of the people around the president.